Welcome back, everybody. Derrick Sue, your East Oakland advocate. Well, last week I had to visit my oncologist, my cancer doctor, to do my checkup. It's my annual checkup. And then what's interesting is that next year on May in 2025, that'll be 10 years that I have. That's been since I was diagnosed with colon rectal cancer. And shortly after that, I started treatment. And so it is possible for those with colon cancer to survive and live a long life. And I'm a 10-year survivor. And so I hope that inspires some of you and gives those of you who are just recently diagnosed with that cancer or any cancer that it is survivable these days. And I say that because hospitals have gotten really good. And I even sat on the Co-Applicant Board for Alameda Health Systems, Alameda County's healthcare system for those that are low income, poor, or even victims of trauma throughout Alameda County, because Wilma Chan Hospital, formerly Highland Hospital, is one of the area's absolute premier trauma centers. And it is one of the places where doctors come to for training in trauma, bullets and stabbings, and so a lot of different things. And so a lot of things have changed. And I've been through several different types of healthcare systems here in the Bay Area. The longest one that I was with previously was Kaiser Permanente, and that was because we had double coverage. My then wife, she had coverage from Kaiser, and then I also, for my company, had Kaiser. So it was one of the better health systems at the time, and probably fewer complaints about everything. And other healthcare system here in Alameda County is Summit Medical. And then we have Alameda Health Systems, which covers a lot of hospitals, a lot of county and city hospitals. One of the hospitals when I lived in Alameda was also Alameda Health Systems. That was Alameda Hospital. And that's where my then wife, she had broken her wrist and was treated there. So it's a big system. And I sat on that board, the co-applicant board, and I was one of the trustees and elected official for the board of trustees. And we brought in a system called Epic. And I just want to talk briefly about that. And this is the result of Epic. And one of the things that you have in a lot of healthcare systems is the ability to go look at your records. Alameda Health Systems came out with this. I was on the board from 2019 and 2020, and we were introducing this new healthcare system, and it also provides your healthcare records and information which can be crucial in an emergency. So anyway, back to the cancer, it is survivable. When the most important thing about surviving cancer is keeping a positive attitude. And I know that's probably going to be the hardest thing for a lot of people, and especially the shock of the news when the doctor is informing you of the cancer, the severity, and the possible treatments. And so I went in there with a very positive attitude. It's like, okay, what do we need to do? Because I already figured out I had the cancer because the family history. Grandfathers on both my parents had colon cancer. My dad passed away of colon cancer. So it was, uh, for me, 99.9% assured that I was going to get colon rectal cancer, just like the previous men in my family. So it was, I knew it was genetics, and a lot of doctors were saying no, it wasn't, but I knew it was because it was inevitable. And so, what's nice about this, there's at Alameda Health Systems, you have a way to access your records, and you simply just sign up and put your uh, information number. It's a special sign up number, activation, a personal activation code. And then from that point on, you have access to all of your medical records. And so, getting back to Alameda Health Systems, the hospital is completely different if you haven't been there in the last decade. It's really changed a lot. The old building is gone, and a whole brand new building and campus is in place. In fact, the building where I spent recovering from surgery from colon rectal cancer does not exist anymore. And it's a whole new building. And you really need to see it. It's a beautiful building, very well laid out. Lots of new things were brought in, a whole new dentistry department is in place. A new mental health care facility or office is getting ready to open soon. So there's a lot of new things to help our low income and our indigent with healthcare. And it just simply is just going there, signing up, and getting registered. And, and they'll look at the options to get you medical health care insurance. And that's what they did with me. I was homeless, so I didn't have any money. And they signed me up for Alameda Alliance, which is a healthcare insurance company right here in the Bay Area. In fact, Alameda. And they've taken extremely good care of me. In fact, I would say they are one of the best right now. And I had far fewer issues than with Kaiser, who was the premier hospital and managed healthcare system. But Alameda Health Systems is extremely competitive. And those of you that are complaining about the county hospital, well, you got to figure that uh, things are a little different because you have to serve everybody and not just the select clientele like PPOs and HMOs. You know, those are considered select clientele because you have health insurance that is either paid by you or your employer. Whereas Alameda Health Systems, a majority of the clients that we see at Alameda, Wilma Chan, um, and many of the county hospitals are the poor or indigent or have no health insurance whatsoever. And this is the only place that they can come to. And even our immigrants who may or may not have legal status here in America are also treated. And that's part of the healthcare systems. But what's also really nice is that they work back then with other hospitals. My radiation treatment came through Summit Medical, and Alameda Alliance paid for that. Now, Alameda Health Systems Wilma Chan Hospital has their own radiation department, radiology, and so they can do the radiation treatments right there at the hospital now rather than farming it out to another healthcare group and paying them. So Wilma Chan Hospital has become pretty much a one-stop shop healthcare system for a lot of people. And they're also working on vision care, from what I understand. But um, all of this yesterday was really good news. And in fact, my last colonoscopy came back. It wasn't as clear because I didn't flush as well. Now, there might have been some difference in the formulation or something, but it was clear enough they could see that there were no new polyps, no growths, or anything inside my intestinal tract. So that was the good part. Also, one of the interesting things that I found out yesterday was that the standard for blood pressure has changed. And most of us know 120 over 80, right? Yeah, that's what I was expecting. And then, here's my blood pressure right there. And you see it's 134 over 89. And I said, ooh, that's not really good. And then that's when I was informed. Oh, no, 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 no. It's actually not too bad. You're just slightly out of the norm. So they were saying that my doctor, my oncologist, said that they changed the high blood pressure threshold, and so I'm actually right okay, right at the upper portion at the 89. The lower number is the one that you really need to be concerned with. The upper number is also concerning if it's really high, but they said 134 is not out of the normal range, so to speak. 130, they moved it from 120 to 130, so 134, not that bad. And I held steady at between 130 and 134 for about 15 years. And I've been on medication for high blood pressure, and it's not changed. My goal has always been 120/80, but uh, every time I take my blood pressure, I'm always somewhere around 130, 134. So that's just a heads up for you in the new medical. And that was told to me by a nurse that checked me in, and then also my oncologist at Wilmington Hospital. Weight, my weight has stabilized because, well, it's, uh, I I deal with it. I work with it. I have a diet. I changed my diet when I was first diagnosed. One of the most important things that I did, number one, was I cut out alcohol completely, because alcohol is one of the factors that the doctor said is a contributing factor in my case. Also, I cut out red meat completely, and so I haven't had red meat in, let's say, a hamburger, which was about 2 months ago. That's the last time I had red meat. Predominantly, I eat chicken, turkey, and seafood, and pork. But red meats, I've really limited myself, and it's really helped my digestive system. And one of the things that was disturbing for me was my resting pulse, because when I was active and in my younger days, my resting pulse sat at 60, and at times even as low as 58. And my doctors back then always complimented me that my um, my pulse, heart rate, blood pressure, everything was that of a high athlete. And I said that I did a lot of running. I did also a lot of exercising and working out. So they complimented me on that. But also with that, all of my treatments, the treatments were great all the way through the chemo infusion. That was a month and a half of chemo infusion twice a week at the infusion center at Highland Hospital. And that was the old hospital that was torn down. but the section where I was diagnosed was one of the newest wings at the time. And so it was a real strange transitioning from the old building to the new building, and now everything is the new building. But one of the things that I have to say is that uh, Alameda Health Systems is an excellent system these days. If you're struggling with medical issues and don't have health insurance, please seek out Wilma Chan Hospital here in Oakland, um, Doctors Hospital in Alameda. We also have, I forget the name of the hospital over there in Castro Valley. That's another one that's part of Alameda Health Systems. Get to there and get checked out. Get sign up for a primary care doctor. There's a lot of healthcare centers that are closer to you rather than the hospital. Like myself, I go to the Eastmont Wellness Center, which is the closest to me rather than going to Highland Hospital. So, and that's where my primary care doctor is, and has been since 2010. So I've been with Alameda Health Systems a long time. But one of the things I want to close out with is that this also lets you know of all your history. This is also history that um, doctors have access to, and they can see a lot of things. And so I'm just going to briefly go through them. Malignant neoplasm of rectum, which is my colon cancer, benign essential hypertension, skin lesions of scalp. That during COVID, I had a lesion on the top of my head that would not heal. It was into the second month before I called my primary care doctor, and primary care doctor had me come in, look at that. So it doesn't look cancerous. They did a biopsy, took a chunk out of there, and then sent me to a specialist. Specialist dealt with that skin lesion and removed it, and I think it was 2 stitches in there. And so hypokalemia, tachycardia. Tachycardia is relates to your heart, and that's something that I've had to work with for quite a while now. And what tachycardia is that your heart rate can race on its own for no reason, and that and sustain over 100 beats a minute. That is not normal. Like I said, a lot of in my younger days, in my very well trained days, my pulse would be between 58 and 60, and then here I am these days, and my pulse rate is up near 90, and at times it'll race above 100. A lot of times that could be due to stress or things that are happening, kind of like what happened a couple, not even 2 weeks ago, when my business here was invaded by armed robbers, and they tied us up, beat us, kicked us, and you still see the swelling on my cheek. And that's more what I talked about with my oncologist, because he was asking, do I feel safe at home? Excuse me. And I said, well, about as safe as I can, because it's a work-live space, and I have people in the live workspace 24/7 along with me. But we do have a safe room. And he says, do you feel safe there? I said, yeah, I feel safe there. We're dealing with some issues. And so we talk more on that. And then I got my flu shot. And for those of you in my situation where you're going through cancer treatment, or you have gone through cancer treatment, be sure to talk to your oncologist, more importantly than your primary care doctor, about this particular situation, because they're going to be more in line and in tune with your body and what it can and cannot take. because of the chemo and radiation from your cancer treatment. And so my doctor recommends that I do not take the COVID and the flu shot at the same time. And that's for me. It could be different for you or anybody else, but that was because of my compromised immune system from both radiation and chemo. And he said it's less stressful on my body and my system to break them up in 30-day increments. So I got the flu shot on Friday, and then I'm going to get the COVID RSV shot next month in December. So those are some things, but this can be a real eye opener, and there's a lot of information and history. So it even talks about my depressive disorder in here. So these are all very important informational facts for your doctors, your primary care doctors, your oncologists, or even if you're in a, a victim of a crime, this could save your life. And that was the whole purpose of EPIC. And EPIC is, the goal is to connect all of the healthcare systems throughout California into EPIC, and having your medical history available in minutes rather than long hours and days of trying to secure your records. So believe in the new healthcare systems. Folks, check out Wilma Chan Hospital. It is an incredibly beautiful building. There were a lot of issues at the time, and in fact, the entire trustee board above me was relieved of their duties by the Alameda County Board of Supervisors because of some conflicts that I had with the Board of Trustees. And I stepped down from my position in 2020 because of those conflicts. And the conflicts were, number one, the construction of the building, and number two, the long ongoing employee strike that was happening at the time. And I supported all of the workers and employees. Thanks for joining me today. Hope that helps you in your cancer journey.